Then let us withdraw the echo endoscope more and more up to locate in the duodenal bulb. We locate the echo endoscope in the duodenal bulb with a slight push to impact the tip of the echo endoscope at the duodenal apex, which is the roof of the first part of the duodenum, but move very gently, because here we may induce perforation if the movement is strong or violent. So we should move with the echo endoscope very gently in the duodenal bulb, especially. Here our landmark is the venous confluence. So in the second part of the duodenum, whether at the papilla or in the upper second part, we see the superior mesenteric vein. But when we move up to the duodenal part, I can see the superior mesenteric vein joining the splenic vein and forming the portal vein. Here, the superior mesenteric vein, the splenic vein is coming from below to unite with the superior mesenteric vein and to form the portal vein. If I properly located the venous confluence and started to do clockwise rotation, I can see the superior mesenteric artery, common bile duct, and the pancreatic duct. And more clockwise rotation, I see the inferior. When I come back to the venous confluence and I do anti-clockwise rotation, and I can see here the gallbladder. So let us go to this video. I am now in the bulb of the duodenum, and is and pancreatic duct and superior mesenteric artery. Here, anti-clockwise rotation, and I can see my landmark very nicely, the splenic vein, yes, very nicely seen, uniting with the superior mesenteric vein to form the portal vein. And this confluence is the most far structure from the echo endoscope. And I mentioned before, in the second part is the common bile duct, and here the pancreatic duct, and here the venous column confluence. This is opposite to what we will see in station 4 from the stomach. So from the duodenum, the portal vein is to the left, while in the stomach it will be to the right. And the superior mesenteric vein is the opposite. Here it is to the right of the screen. In the stomach, it will be to the left of the screen, and the splenic vein coming from deep, from below, it will come from up in the stomach. Let us see the station 4 in the stomach later on, but now we will concentrate on the station 3 in the bulb of the duodenum with the meeting of the splenic vein from below, superior mesenteric vein coming from the right to form the portal vein. So the portal vein, I can see it from the bulb of the duodenum. Yes, this is the venous confluence, very nice. When I do clockwise rotation, I can find the common bile duct, pancreatic duct, superior mesenteric artery. And more clockwise rotation, I can find the major vessels, aorta, and inferior vena cava. This is the venous confluence, clockwise, I can see the aorta and the inferior vena cava. Okay, let us go now to the station 4, which is the most important and the most rich station. That's to say, examination of the intra-abdominal structure from the stomach. I can see all the abdominal structures, including the whole pancreas, including the head. And even I can see the papilla in most patients, not really in all patients, especially in thin patients. But in obese patients, sometimes in obese patients, I can see the papilla. But in up to 80% of patients, I can see the whole intra-abdominal structures, including the head of the pancreas, neck, body, and tail, and the whole length of the common bile duct, the whole length of the pancreatic duct, papilla, and of course, the aorta and its branches, and the venous confluence, and also the uncinate process. So I can see all structures from the stomach, including the papilla, in up to 80% of patients. Here, the echo endoscope is located at the cardia. We start at the cardia, or just below the cardia. At the cardia, I should search for my landmark of this station, which is the abdominal aorta, appearing as a longitudinal structure. This is at the cardia or through the cardia. This fleshy structure is the right crus of the diaphragm. This is the right crus of the diaphragm. And the first big branch here is the celiac trunk. The first big branch is the celiac trunk. Okay. I push the endoscope downwards, push it inside the patient. Here I can see the first branch. The first big branch is the celiac axis with its 3 branches. Left gastric going to the right of the screen, splenic artery going to the left of the screen, and when I do anti-clockwise rotation, I can see the common hepatic artery going down and then dividing its 2 main branches, the hepatic artery proper going to the porta hepatis and the lever hilum to join the portal vein and the proximal common bile duct and the common hepatic duct. And the other branch is going to the left side of the screen, which is the gastro-duodenal artery going to the pancreatic head. And I can see also the superior mesenteric vein. Then let us start our video, starting examination of station 4. Okay, this is my landmark, the abdominal aorta appearing as a longitudinal structure. And here, this fleshy part is the right crus of the diaphragm. And this is the first large branch of the abdominal aorta, which is the celiac axis, expecting to see the left gastric going to the right of the screen, the splenic artery going to the left of the screen, and if I do anti-clockwise rotation, I can see the third branch of the celiac axis, which is the common hepatic artery. Then let us start examination. Yes, very nicely. This is the abdominal aorta, and this is the celiac axis, and this is the superior mesenteric artery. And this large branch, the third branch, is the left renal artery. And here, expecting the splenic vein. Let us see first what is happening. This is the celiac axis. I will concentrate in the celiac axis. Yes, yes. This is the celiac axis, and this is the left gastric artery, and this is the splenic artery, and this is the splenic vein. Here is the region. This is the region, starting the region of the body of the pancreas at the level of the splenic vein. But let us concentrate on the branches of the celiac axis. That is very important because sometimes I find malignant pancreatic body mass. It is important to see its related to the celiac axis, because any abutment, that is to mean abutment means that involvement of less than half of the circumference of the celiac axis, or encasement involving of more than half of the circumference of the celiac axis, this means that the patient is inoperable. So it is very important to locate and examine properly the celiac axis and its branches. Let us continue the video. Yes, this is very nicely seen. The seagull, what is named as the seagull. The seagull is a bird, have a body and 2 long wings. This wing of left gastric artery, and this is wing of the splenic artery. Okay, when I do anti-clockwise rotation, this is the third branch appearing by anti-clockwise rotation. This is the third branch of the celiac axis with the common hepatic artery. And here, this is the venous confluence. This is the splenic vein. Here, coming from up, opposite to the duodenum, and uniting with the superior mesenteric vein to form the portal vein going to the hepatic hilum, and this is the liver. The common hepatic duct will give rise to its main branches, the hepatic artery proper accompanying the portal vein to the hepatic artery, and the gastroduodenal artery going to the pancreas. So let us continue the video. Yes, this is the common hepatic, very nicely seen. And here, this small branch is a hepatic artery proper. It is not a small, but it is one of its 2 terminal branches, the hepatic artery proper, and this is the gastroduodenal artery going to the pancreas. So this is the seagull of the common hepatic artery. common hepatic artery proper, and the gastroduodenal arteries. So this is the second sigal. The first one is the celiac with the left gastric and splenic. The second is the sigal of the common hepatic artery into hepatic artery proper and the gastroduodenal artery. And here nicely seen, sorry, and here nicely seen the third sigal, which is the splenic vein, venous confluence, uniting with the superior mesenteric to form the portal vein. So these are the arterial and venous sigals at station 4. This is the splenic vein coming from up, and the superior mesenteric vein coming from the left side to form the portal vein going to the right side, opposite to that of the duodenum. So we saw now 3 sigals, 2 arterial and 1 venous sigal from this station. Okay, we are now still in station 4. It is a very rich station, as I mentioned before. We push the echo endoscope very minimal, few centimeters downward to see the superior mesenteric artery. So this is the celiac, starting the left gastric. We are now concentrating on the superior mesenteric artery. So this is the celiac axis and the superior mesenteric artery arising from the aorta. And this is the superior mesenteric vein. The part of the pancreatic tissue in between the abdominal aorta and the superior mesenteric vessels, whether superior mesenteric vein or superior mesenteric artery, this is the uncinate process of the pancreas. We saw it from station 1, just below the papilla with upward deflection, and we are now seeing it from middle aspiration of a uncinate process mass, because there is a long distance to reach the mass, and you should pass through an important structure, somewhat risky. Some endosonographer are brave hearts and can pass through any vessel, but I don't prefer except if I oblige to. But if there is an uncinate process mass, simply I can go to the deep second part of the duodenum. It will be very near to the echo endoscope. Let us complete. Let us go on. This is the abdominal aorta, celiac, superior mesenteric artery, superior mesenteric vein, and part of the pancreatic tissue in between the abdominal aorta and the superior mesenteric vessels, artery and vein. This part is the uncinate process mass.